It's estimated that more than 1 million people in the U.S. are living with Parkinson's disease. Diagnosing the disease early can often lead to better outcomes for patients. Joining us now to talk about this is Dr. Michelle Dakistein, a neurologist who specializes in movement disorders. She's with the Hartford Healthcare Group in Cheshire. Good morning, good afternoon, I guess I should say. Thank you for being here, doctor. So one of the biggest people that we know that deals with Parkinson's disease is Michael J. Fox. Can you tell us when are most people diagnosed? When do they find out?
You know, the average age of diagnosis is 58 years old, although Parkinson's disease is one that can span any decade. We have juvenile Parkinson's that gets diagnosed under 21, then young onset between 21 and 40, and then the typical age 58 to 90s.
What types of symptoms usually present with Parkinson's?
Typically, Parkinson's presents with symptoms on one side of the body first, either the classic tremor that people are familiar with that occurs at rest, and then as soon as you go to use the arm or the leg, the tremor would stop. You can also have Parkinson's without tremors, so you can have stiffness or slowness, described as weakness or sometimes dragging a leg, loss of fine motor movements, loss of facial expression, soft voice or a raspy voice, and then oftentimes changes in the way that people walk, where they're stooped or shuffling and have decreased arm swing.
Dr. Dakistein, what advancements have been made with this treatment? Because Parkinson's has been around for a while.
There have been a number of advances in various areas of Parkinson's treatment. First and foremost, I think we're much better at diagnosing it sooner and educating patients and their families. This is one of the greatest advances that we have, because when patients are educated that Parkinson's is much more than a tremor or stiffness, there are motor symptoms, non-motor symptoms. We educate about diet, exercise, sleep. We have integrative medicine now for a more holistic approach. We have updates in medication that help keep our dopamine levels in our patients where we want them, so not too high or too low. And we have medications that treat other chemicals involved with Parkinson's, as well as advanced therapies with deep brain stimulation and infusion therapies.
Dr. Dakistein, we have about 20 seconds left. There's a symposium about this topic later this month in Hartford. Can you talk about that quickly?
Right, I'm a board member of the Connecticut APDA, and I'd like to invite anyone interested to register online and join us for our annual Parkinson's Symposium. It will occur April 30th at Hublin Hall at Hartford Hospital and include information about diagnosis, integrative medicine, medication, and also advanced therapies.
Dr. Michelle Dakistein, a neurologist that specializes in this disorder, joining us this afternoon. Thank you so much for your time. We appreciate you.
Thank you.